Hi everyone, my name is Dr. Michael Wold. I want to welcome you to this conversation at the Awakening Fair on Lyme disease and other lies. And what I mean by lies is maybe misunderstandings or misinformation that many of you might have been given over the years. I talked with at least one of you that mentioned that you have a girlfriend who has been suffering with Lyme disease for decades at this point. And there are many misconceptions that might have led to that, which would fall under the category of the lies and misunderstandings in terms of traditional treatments. Again, my name is Dr. Michael Wold. My branding name is The Blood Detective. If you search for Ask the Blood Detective on any podcast platform, that will pull up all of my shows, which are on every Tuesday. So the Ask the Blood Detective podcasts are meant for people who want to learn. They're not superficial conversations. They require some listening. And of course, you can listen to them again, but they're meant to get right to the heart of some of the most important concerns that I've heard from you, from patients over time regarding this topic of Lyme disease and other infections. To get in touch with me, you can call me at 914-552-1442. And my website is drmichaelwold.com, and my nutrient website is blooddetective.com. All right, so we are going to talk about Lyme disease here. So someone had mentioned the question of, is Lyme disease even from a tick? So the prevailing thought right now is, yes, Lyme disease, the major vector of transmission, it's called, is from a tick. And these deer ticks are very, 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 very tiny. Of course, it wouldn't surprise me if you heard that other ticks can carry Lyme disease or other vectors. That'll certainly a possibility. If you consider that, you might actually have some better explanation as to how you or someone else actually developed Lyme disease, because if you don't consider that something can do it, then you don't, and then you're like, well, we don't know what did it. And then over time, as individuals in medicine get smarter, they're like, oh yeah, sure, we could possibly get COVID from a cat or even from a banana. So, and that's not a joke, it's actually possible, but you have to first consider that. So in terms of infections and vectors, which is the term meant to describe how a person, because we're speaking about people, get Lyme disease. So it is thought, as I mentioned, that Lyme disease starts from a tick, from a deer to a tick, the tick to a person. And these little tiny, tiny ticks are extremely small. Most people are not aware of them. They may get an infection. They may not even have the traditional bullseye rash that we've heard about. More recent studies have said that if you even have any skin reaction that's greater than 2 inches, it could look like anything. You should strongly consider Lyme disease as a cause of that. That's almost an exact paraphrase from an infectious disease journal already several years old. Now these ticks, and let's just, let me back up for a moment. So that's one vector of Lyme disease. But in terms of infection in general, what also can happen is a person can transmit, you can get an infection from one person and you can give it to another, person to person. And another example of that would be, let's say, a pregnant mom passing on an infection to their child. And you might say, well, you're not going to pass on Lyme disease that way. And I would say you're technically right, but if you have damage, let's say, to your nervous system, and then there's other aspects of your body that are also damaged from Lyme disease, you might create a very hospitable and abnormal environment for the development of an embryo, and that developing child may develop all sorts of neurological problems. And just like if someone has hypothyroidism, if a mom has hypothyroidism and she doesn't know about it, you'll find all sorts of special needs, and diminished IQ and intelligence quotients go way, 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 way down in these offspring. There's so many ways we can screw each other up, it's unfathomable. And then, of course, you can get infections of different types from animals to humans, maybe even humans to animals. When I was in, both chiropractic school and medical school previously, they taught us that, we don't really get infections from animals except for like toxoplasmosis from cats, and there were a couple of others, but generally speaking, it was like, no, it doesn't happen. We know what happens. We not only know we get infections of all these sorts of types just by kissing your pet or touching your pet, getting saliva on you, touching your mouth and your nose, but there are many other vectors as well. And I'll mention more of them as we move along. So let's talk about testing for Lyme disease, because I know that is a very confused aspect of things, and I'll be very succinct. So with testing, you might know that there are Western blot and ELISA testing, and you've heard maybe of immunoglobulins, like immunoglobulin G. Like how many bands do you have that's immunoglobulin G or immunoglobulin M? So the prevailing thought right now, which can change any time, is that you're considered to have Lyme disease if you have symptoms and you have at least 5 IgG bands. If you have 4, sorry, you just don't make it. So someone made that up. It doesn't mean you don't have Lyme disease. You can have no bands and have Lyme disease, but the way that physicians operate is that's what they base it on. And if you don't have enough bands to substantiate a diagnosis of Lyme disease, either 5, as I said, or more immunoglobulin Gs, or 2 of the 3 immunoglobulin M bands, either one or both, okay? IgGs, when you get exposed to any infection, your body usually builds up immunoglobulins, and those are the IgGs. And they tend to last for many, many months to many, many years to forever. So they might simply mean past exposure. They're kind of like a memory of it. But for whatever reason, medicine, they've correlated, and not very well, honestly, that the higher number of bands, the more probable your diagnosis of Lyme disease. There are many other conditions, health problems that can artificially increase immunoglobulins. So that's why a practitioner has to kind of weed all this out and not just pretend that you're a textbook. For example, if you're protein deficient, you're not going to make immunoglobulins very well. So then if you're exposed to something that's supposed to produce immunoglobulins that you're testing and they're not there, you're like, well, you're normal, and I don't see any Lyme disease, so you're obviously crazy, so why don't you just go to a therapist and get on an antidepressant? Have you heard that one? That's a big one. So, and then there are other labs that say, no, we do the right bands. We know the bands, like immunoglobulin band 41, for example. Well, a lot of these labs have taken advantage of the confusion among the general public, and they popularized other bands that mostly were just not well even studied, in my opinion. And my opinion can change, but when I've talked to those PhDs and physicians at these labs, they have not been able to give me any sufficient evidence to support what they're doing. But people flock to them, spend all the out-of-pocket money for these tests because they're desperate. And they distrust medicine, and I can get that, and they figure this is a holistic lab, so they must be right, and then when the test is positive, they'll say, see? That doesn't mean there's a cause and effect relationship there. That just means you could be there, it's a big deal. It's just like most of you, if I tested you, might have antibodies that are consistent with lupus, ANA antibodies. But if you did, and you didn't have any other symptoms, your doctor would say to you exactly this. Don't worry. Lots of people have this positive, and they never have any issues. Well, that might be true, and it is true. So in other words, if you happen to have some symptoms, right, and then they test you for this, they might connect that they're related. They could test 25 other things, and maybe the other things were more important, or some of those. So it's important that in order to make a proper diagnosis and to change and be malleable in how you approach a person, you want to consider whatever tests seem to be the most appropriate relative to the person's symptoms and very detailed conversation and questionnaires. And then ultimately trying different things, either natural or medical, and to see what happens and to see what happens to the lab so you can learn the relationship, because it's not always super apparent at the beginning, Okay. Any questions or input on any of that? Yeah.
So IgG is indicative of a past infection. What is
Generally speaking.
What is IgM?
IgM is more acute infection within the last several weeks to possibly a couple of months, okay? And those immunoglobulin M's, they could last for long periods of time, just like the immunoglobulin G's can. So, there are problems with that because you might have heard that, for example, like with COVID, if you have immunoglobulin G levels increased, then they say, well, that shows appropriate resistance to the infection. Well, it might show that, and it might completely mean the opposite of that. It also might even mean if those immunoglobulin Gs were caused by, let's say, a inoculation, like a vaccination, okay, for COVID, that you actually now have an increased risk of having mutated forms form in you that you then pass on. And I'm saying this on audio. This is scientific fact. So one of the downsides, you might say, of the vaccinations is that they increase your risk of developing more mutated, virulent forms of infection that you pass on. I'm going to Costa Rica very soon. I went to the Costa Rican consulate website about the COVID restrictions. I needed to know what was going on. It says that everything I just told you, they said it right on the website. They said, well, even if you're vaccinated, which means that you are more susceptible to giving and receiving the Delta variant plus others, you should get a booster. But the booster is kind of like the original shot in the sense that it's working the same way. You're kidding? So of course that's all approved right now. Clearly it's political, it's not scientific, it's a nightmare. It's a nightmare, it's unbelievable. Then the other thing about Lyme disease, or any of the other co-infections, babesiosis, ehrlichiosis, and there are a few dozen other types of infections, both bacterial and viral and parasitic, that can be on those ticks. So with our level of knowledge, at one point it was all about Lyme disease. So Lyme disease, Lyme disease, Lyme disease. Some people got better, some people had co-infections no one knew, so they suffered. Then we got smarter, then we started to check for these 3 major co-infections, and that helped a lot more people. And then I have patients who are still getting, they'll come to me, they're getting intravenous antibiotics, and they say, Dr. Wald, I only feel better when I get this, so I know I have Lyme disease. Wrong. You might have Lyme disease, and the antibiotic may be making you feel better for that reason, but antibiotics used for Lyme are also anti-inflammatory. So you can have inflammation from any other of a zillion different infections, and you think it's Lyme disease because that's all you've known. You see, that's a problem too. Some patients have said, well, why would I feel better if I didn't have Lyme? For that reason, because these antibiotics are anti-inflammatory. And I do believe too that you cannot beat Lyme disease with nutrition. No way. You can try, but everyone I've known who's done that I've followed for several years has always had neurological issues. So the neuroborreliosis, which is caused by the spirochete of Lyme disease from ticks as a vector, can create many chronic symptoms. Anything from severe neurologic problems that could look like all kinds of diseases. For example, I had a patient whose brain MRI looked like multiple sclerosis, but it was most likely from damage from Lyme disease, and then Lyme disease was cured, but your body is now left with the aftermath of all of that damage, you see. And most lay people don't quite get that, at least not initially. They think it's just active infection. You can have an infection, it causes problems, it can damage your heart, it can set up inflammatory stuff, which can give you a stroke by thickening your blood. You name it, it can do it. You feel all kinds of symptoms. Depending on where the symptoms show up, you go to that specialist. The specialist does what he or she does, and they find something or they don't, and then they refer you, and then that doctor doesn't talk to this one, and they don't really care to either, and there's this hierarchies in medicine about who makes the shots. So why am I mentioning all this? Because it's absolutely ruining lives. It's absolutely ruining lives. And we're talking from children all the way up. So what do? Well, obviously you want to mitigate your exposure to any way that you can, just like with COVID. So if you're of the belief that, masks work and distancing, works and hand washing works, and these sorts of things, then you do that because there's physical barriers, right? But then there's also the internal resiliency factors that you can mitigate these different conditions. So with Lyme disease, I do believe in whatever co-infections are there, that you treat that medically as you should. Then, depending on what's there, what medications you're using, you consider different nutrition and also some same nutrition across the board. So for example, turmeric. Turmeric is one of the most anti-inflammatory compounds that you can consume, but not just any turmeric, because turmeric is very poorly absorbed by mouth. If you take 100 milligrams of turmeric, you will excrete in your urine 95% of that. Maybe 90% at best. You will excrete, you'll only be left with 5 or 10%. But if you take that turmeric and you encapsulate it and process it with biopterine, which is black pepper fruit, you reverse that malabsorption ratio, so you actually absorb about 95% of it. Now you might say, well, that's great, so how much do you need? What I didn't mention on the previous talk, but I'll mention to you now, is that when taking different nutrients, you want to figure out the right doses. Because I have people that come in, very smart people, they give me their list of nutrients, everything is right, but the doses are wrong, they don't take it at the right time, they're taking it with the wrong foods, then they don't even consider that even if you get your nutrition perfectly right for, let's say, your Lyme disease, but if you're exercising or stressing and not sleeping and you're underhydrated and you don't account for those, you're just eating away at that nutrient pile, and then you're wondering why it's not working. But these are just very common errors that I see. You need to do everything you can to reduce the stress on the body in Lyme disease and infections. So how Lyme disease and infections in general tend to do us in, or at least to cause disabilities of various types, is the inflammatory process involved with them. When I say inflammatory process, there's not one process. That's like saying there's a meaning of life. Obviously there's not. There's meanings of life, and they may change every second of every moment. So you want to be accurate with it. Otherwise you relate to everything wrong. So inflammation is a universal factor in all inflammation, but not all inflammation is the same. So some people say, oh, Dr. Well, I took cat's claw with my Lyme disease and this, that, and the other thing. And I look at all that, and I've read the, the papers on it, and there's some weak evidence for that. But even if there was strong evidence for that, if that person is, again, protein deficient, they can't make the immunoglobulins, that's a big problem. You can take all the cat's claw you want, or antiviral homeopathics. I mean, they're not gonna work. If you, for example, are working out in the gym and you don't eat enough calories, you're going to be tired and you're not going to get as much from your workout, right? So it's the same with these infections. Infections hyper-utilize nutrition in the body. That means they cost you a lot of nutrition and they eat into your nutritional reserves. So then people take the right level of nutrients where they don't consider the prior hyperutilization. So I'll say, I'm taking 50 milligrams of zinc, Dr. Wald, okay, assuming it's the right form of zinc. But if you were super deficient before, you might need 150 for maybe a month or two to get that in shape. And then to get the other effects of immune modulation, positive immune modulation, you might then have to take that zinc at 50 from there on, you see. The right dose, at the right time, for the right condition, as it's changing. Sometimes I'll see people, I give them protocol, then I don't hear from them. And I'm like, well, what happened? They said, well, you gave me the protocol, I'm starting to do it, and I'm feeling better. But even if that were true, their nutritional needs have just changed. So sometimes you need to do certain testing to make sure that things are actually working, because if you rely on just how you feel, one day you feel good, and the next day you can't remember a damn thing because of Lyme disease, let's say, damaging your nervous system. The inflammatory mediators and the destructive changes get to a point where then finally you notice them, and you think they're brand new. It's not that different with other diseases, like let's say cancer. You just wake up one day and have cancer. Never. There's a process that occurs over the course of months or even years, then it gets to a point, then you have other symptoms. So there is the infection that you're exposed to, and then, so that's the external factors, and then I mentioned before, there's the internal factors. So we have various levels of immunity. So I have on my podcast, Ask the Blood Detective, I did a show on immunity, and I explained from the very get-go that there are 3 basic immune systems that we have. So if you're told, well, this is the best product for the immune system, your index of suspicion should go up and say, well, what do you mean by that? Which immune system are we talking about? Do you mean the cell-mediated immune system, where cells, called white blood cells, mediate the immune response, cell-mediated immune system? Or are we talking about the immunoglobulin immune system, which is more like a chemical antibody immune system, okay? And that requires different nutrition and some of the same nutrition. And then the third major arm of the immune system is called the complement immune system, because it complements the other 2. And they're connected, of course. To say they're not connected, or to say they're related, as I mentioned in the last talk, is an improper semantic way of looking at it. And if you look at these things as separate, you treat them as separate, and sometimes you get well, and often you don't. But if you know they're together, I always treat all 3. And there may be others, we don't know, but at least we know that, you see. So when I mentioned turmeric earlier as just one thing, how do you figure out dosing of nutrients that you would use in infections? And I'll talk about some specific nutrients as well to consider in all infections, and certainly a heavy emphasis on Lyme disease. Before I do that though, any input, any question on anything? This is your time, so we're good so far?
I have a few questions.
Yes.
Do you also test for mercury poisoning? Because since the symptoms seem to be the same, so I'm just curious.
Yeah, no, it's good insight. So you're asking, do we check for mercury toxicity or mercury poisoning, because the symptoms of that and Lyme disease or any of these infections could be very similar. Well, mercury, for example, stores itself in the brain commonly, you see, and that can cause degenerative changes in the brain, which look exactly like the degenerative changes from Lyme disease. An inflammatory condition set up in the brain, let's say in Lyme disease, that can cause a plaque, and the same or different inflammatory conditions can be set up by mercury, which can cause a plaque. I remember visiting a patient in the hospital years ago, and I looked at their MRI there, and it looked like it was MS, but I knew that the person had neuroborreliosis, which was Lyme disease, and I mentioned, I was talking with the infectious disease doc, and I said, this looks like an MS plaque in the Lyme Disease Association. She said there's no association. She was giving me the answer she might give to any other patient asking her any question about anything that she was annoyed at and didn't know and didn't want to talk about right there and then. But when she said that, I just happened to have one of the journal articles in my back pocket. Literally, I said, well, here you go. Lyme disease, this is in the Lancet, which, as you know, she says, I know what the Lancet is. I'm like, okay, so where's that attitude coming from? What? Stop, I said. Just look at yourself. Stop embarrassing yourself. Take yourself out of the equation here. This is not about you. This is about this child. And then we had a more reasonable conversation. She looked like she was going to run, but she's stuck in there. So this is what a lot of my patients are dealing with. And I certainly had dealt with that because some of my patients asked me to be their advocate, so I'll show up at the hospital just making sure things are going the way they should go. So the other issue with the whether it's metals that cause brain issues. Now, if you have Lyme disease and you also have metals and you also have hormonal deficiencies and you have these other health problems, all of that's just going to set you up for a worse scenario, obviously. So there's only so much resiliency your body has to dealing with different things. It's got a finite level of response. And once the body starts to heal in excessive ways, like an excessive stress response, it starts to break down the body exceptionally quickly. Because first of all, inflammation actually has some positive benefits on the body. Inflammation is actually a part of the process of how we get rid of infections and how we degenerate old immune cells to generate new ones. But like cancer, which has too many cells copying themselves too fast that are abnormal, that is cancer. The copying of cells is a normal thing. But if you copy too much, or you're infected, or you have a toxic metal, you damage DNA, and then the replication rate increases. They call that proliferation in cancer, which again, proliferation of cells is a normal thing, but then it becomes an abnormal thing, you see. That's pretty much how the body works in terms of disease, that the processes that are normally normal for the body become excessive and therefore abnormal, and the body can't keep up. And I mentioned previously too that there's this hyperutilization of nutrition and also hyperutilization of foods that are consumed as well. So I have to work carefully with people's diets to make sure that they're consuming the right calories from the right places. If someone comes into me and they have thin muscles or hardly any muscle, they're protein deficient. I need to make sure the right proteins are getting in. I also need to make sure that they're absorbing those proteins, because if they're absorbing those proteins, they can make the proper immune resiliency cells against Lyme disease and other infections. Other problems that are associated with infections is they love oxygen-poor environments. So people with Lyme disease and other infections tend to do well under hyperbaric conditions. So when they're exposed to oxygen under pressure, which extends the oxygen levels cellularly, that creates an environment, that high oxygen environment, that Lyme disease and other infections do not like. But generally speaking, across the board of many different infections, many dozens, if not hundreds even. So with some patients, we're using hyperbaric therapy. We also know that any nutrition in the blood of a person during the time of hyperbaric therapy is hyper pushed into their tissues. It's a much greater delivery. And okay, so in terms of what is the right nutrition for Lyme disease? Well, one is complete and I should say not complete, but assess the nutritional needs of each person and what they actually need in general. That's number one. Because if you're fatty acid deficient and you don't eat lots of vegetables and your issue is gluten this and yours is yet another, you have to manage those issues. Then you have this infection, let's say, or infections or toxins, and then you consider what the literature says, the medical literature, scientific studies about, okay, these are the nutrients and these are the foods to think about more in general, and then you see if that information applies to the person given their concerns, and then you add that in. And then you look at their chemistries, like their blood work, for example, and if they show high levels of inflammation, then they may need more omega-3 fatty acids. They may benefit from more turmeric, let's say, or resveratrol. And you'll know, because if you give these things and the markers come down, you got it, And the person might not feel better yet. Let's say you reduce the inflammation all the way down to here, the person's feeling terrible, and you reduce it here, they're still feeling terrible. They'll say, why do I still feel so bad, doctor? Well, you're telling me my labs are better. Well, because they haven't been reduced very long. And plus you haven't even healed from that exposure. So, it's someone like someone punches you in the face, you stop punching them, they still hurt. But in time, they will recover, right? So people are left with all these degenerative side effects of the infections, and many doctors ignore them. They just do the Lyme disease 21-day protocol pretty much, and then if you have a problem after that, it's like pulling teeth to try to get another 21 days going if you seem to not respond. They'll just say, no. Once you do the medications, it may take you several weeks. It may even take you a few years to recover. And it's true in medical circles. That's what they see because that's how they treat people. I would say mostly inadequately, but there are exceptions. So it's important to not only figure out the issue, like Lyme disease, not only give the right medical treatment if it exists, doxycycline, let's say, or amoxicillin if you're sensitive to that, or whatever. And of course, the varying levels of nutrients, like giving more zinc for immune modulation. Zinc helps all three of those immune systems. The right dose at the right time and the right form of zinc. Should it be a zinc citrate chelate? Should it be a zinc picolinate? It depends. It depends on a lot of other factors. Again, I mentioned the proteins. And in terms of other nutrients, let's see what I have on my list here. Hormones. Because, depending on your age, your whole hormonal balance is part of the susceptibility factors to disease. So if you have low level of hormones, that usually means that abnormally low levels, your immune system tends to reduce. That means all the floodgates are open for infection. Inflammatory mediators and genes that encode for inflammatory mediators increase drastically, you see. So you might want to look at hormonal treatments for people with Lyme disease once you've done all the traditional stuff to stimulate healing. Just like a bodybuilder might take testosterone to stimulate muscle growth, but if a bodybuilder doesn't eat enough food or enough protein, the muscle growth will not be even close to what it could be on the testosterone. You fix the nutritional needs of the person, including any hormonal deficiencies that they have, so the hormones allow your body to use the nutrients you're taking. And then we talked about in the prior talk that you are not what you eat, you are what you absorb, and I'll go even further, and your health ends up being the consequence of what you don't absorb. So you can take all the zinc in the world, but if you're over 50, you might need a lot more than if you were 30, you see. What's a lot more? You look at the testing. Now, testing for nutrition, by the way, and I mentioned earlier, I wrote this 500-page textbook on nutrition, and in this book, I might tell you the nutrients to take for different sets of labs, but it doesn't know if you absorb or malabsorb. It doesn't know, like if you looked for the Lyme disease test in there, it would tell you what to consider, but what if you had 20 other abnormal tests that you find in the book? So it takes a brain to put that together and say, oh, it's this, to distill it down to what you actually need. A lot of people that I see, they tend to be much smarter than average, people that go to talks like this, and they're almost too smart for their own good, because they'll know certain things to take, but they haven't had the training to know how to weed it out and how to prioritize and how to properly test and retest, so you know you're continually doing the right thing. Because the right nutritional therapy for Lyme disease or anything else, any other condition, could be appropriate for the time you started, but may not be the same 6 months later. Again, my son, who's a natural bodybuilder, well, that's just one thing he does. He's in college studying psych and Japanese, but he said to me, "Yeah, Dad, I got to this size, but I can't seem to, improve beyond that." I said, "Okay." I said, "Well, what's your diet like?" And he says, "Well, it's been what it's always been." I said, "Well, that's the problem, because that was the diet that was appropriate to get you here, but that's maximizing your protein and your growth, so you need to go more." So one of the best ways to, did that make sense? Mm-hmm. So one of the best ways to personalize nutritional dosing is not blood levels of most nutrients. There are some exceptions to that. Vitamin D3 is an accurate test. But most of the other vitamin tests, those are plasma and serum tests. They only tell you the last 3 to 4 days of your dietary intake of a nutrient. They don't tell you anything about long term. So a lot of my colleagues, they measure all these tests and they misinterpret them because they're just wrong, and then the person wonders why things aren't happening 5 years later and $12 million later, whatever it is, Body composition. You measure your body composition. That's called bioimpedance testing. That means the test involves putting a current through the body through electrodes on your hand and on your foot, generally the right side, and that current goes through all of your cells. You don't feel it, but it goes through muscle, water, and fat at different rates, because muscle is more dense than fat, which is more dense than water. So those resistances are calculated, fed back to the computer. The computer now, I can know what your metabolic rate is, exactly, pretty exactly. If I know your metabolic rate, I know how you burn calories. If I know how you burn calories, I know how to dose your protein, carbs, and fats in your diet and your dosing of your supplements. If you're just taking these things, you're only taking dosing on a bottle that some guy or gal from a lab just figured out, in some companies, not very well. That's why I'll see the differences in, let's say, one multivitamin from another company or one vitamin C level to another. They all just made up stuff that fell roughly within the ranges of acceptability for the regulations regarding labeling of nutrients. But none of that has to do with your actual needs. That has to be determined. You may need hundreds of times the amount of vitamin C than the recommended daily allowance, which is also called the recommended daily intake based on the recommended daily values, says, right? Vitamin C, for example. You ask a regular doctor, when you have Lyme disease, your interns, for example, maybe it's your infectious disease doctor, and you say, how much vitamin C do I need? Because I know that vitamin C is antiviral. I say, well, you just drink orange juice, you're good. So orange juice will give you 60 milligrams based on the books, okay? 60 milligrams loaded with sugar. You're drinking, 10 oranges at one time. If that doesn't give you diabetes, I don't know what will. So even if it was the right amount of vitamin C and it's not, that's wrong. You could take vitamin C in a pill and you'll get that exactly right. I'm not saying ignore your diet, but don't drink fruit juices, okay? The body composition, again, back to that, tells us metabolic rate, it tells us the percentage of muscle, water, fat in the body. It tells about the level of hydration of cells in and outside of the cell, and then something very important called phase angle. Phase angle is a marker, it's a number that tells if you're really truly enhancing the life and health span of the person. Thank you. You can do all types of things to improve health and healing, but if your phase angle does not increase, then you're not doing it. Say this piece of paper, your cells is loaded with healthy energy. We all know from this symposium here that if you have disease, you have lower energy, but we actually can measure it now. You put the current in the body, it bounces off the cell. If the cellular energetics is high, then you get a bounce off value that is high. If it's low, then you go low, and that's bad. So they've correlated the oncologists that even if your tumors are gone and your cancer markers are gone, if your phase angle is small and low, it's coming back. But if all those things are existing, but your phase angle is high, that's probably a real fix. So summary is, with infections, whether it's Lyme disease or anything else, you want to treat the infections the appropriate way that they're supposed to medically be treated. And always, always, always enhance that effective healing for the long term with the right nutrition. So the right nutrition can be based on certain tests, conversation, body composition for dosing, and that's the best way, in my opinion, 29 years of doing this. Final questions before we end today? All right. If you want to reach me with questions after, if you have any topics that you'd like me to cover during my podcasts, which are again every Tuesday on any podcast platform, including iTunes, just search Ask the Blood Detective. You can call me at 914-552-1442. Go to my website at drmichaelwald.com, and that's it. I want to thank you very much. Thanks for joining me.